Now let's talk about the male internal genital organs. These include the vas deferens, the ejaculatory duct, the seminal vesicles, the prostate, the urethra. The urethra includes the prostatic urethra and the membranous urethra for the internal genital organs. So now let's talk about this structure. So what do you see here? You see here the vas deferens or the ductus deferens. These are thick-walled tubes of 18 inches. So they are extremely long, okay, 18 inches. They're going to convey mature sperms from the epididymis to the ejaculatory ducts and the urethra. Where is the vas deferens going to arise from? So please remember T for that. It is going to arise from the tail of the epididymis, and then it is going to pass through the inguinal canal. And then it is going to emerge from the deep inguinal ring. So now we are gonna, first of all, I told you something about T, which is for the tail of epididymis and inguinal canal. Now let's talk about a ring. So it is going to emerge from the deep inguinal ring. Okay, so when we have a ring, we expect two more people to be there, right? So it is going to pass around the lateral margin of the inferior epigastric artery. So this is the girl whose name is Leah. Deep inguinal ring is going to pass around the lateral margin of the inferior epigastric artery. So what are we expecting now? We are expecting Leah to meet Paul. So the Paul is DV Paul, right? So vas deferens is going to pass downward and backward, D and B, on the lateral wall of the pelvis. Then the vas deferens is going to cross the ureter in the region of the ischial spine. And then the vas deferens is going to run medially and downwards on the posterior surface of the bladder. Then the terminal part of the vas deferens is dilated. So this is the terminal part of the vas deferens. This car is the vas deferens. This terminal part of the vas deferens is going to be dilated in order to form the ampulla of the vas deferens. And the inferior end of the ampulla of the vas deferens is narrowed, and ejaculatory duct is formed by the ampulla of the vas deferens and the duct of the seminal vesicle. Now let's talk about the seminal vesicles. So what do we see here? We see here the vas deferens, which we have talked about. And here this is a very lobulated organ, which is present right here. And this is the ejaculatory duct, and this is the prostate and prostatic urethra. So seminal vesicles are two lobulated organs which are 2 inches long. Like they are very small, okay? And they are lying on the base of the bladder. So they are going to lie on the base of the bladder, and they are 2 inches long. Each seminal vesicle is going to consist of a much coiled tube which is embedded in the connective tissue. So this is a very, very, very coiled tube, and it is embedded in the connective tissue, and it is on the base of the bladder, and it is lobulated as well. And the terminal part of the vas deferens is lying on the medial side of the seminal vesicle. You can remember this with VM. And then we have PR. So posteriorly, the rectum is going to be present, and medially, the vas deferens is going to be present. Now, the ampulla of the vas deferens and the seminal vesicles of the same side are going to join to form the ejaculatory duct. Okay, now let's talk about the blood supply of the seminal vesicle. It is very easy. It is the inferior vesical artery, which is a branch of internal iliac artery. And then we have the middle rectal artery, which is a branch of internal iliac artery as well. And the veins are going to drain into the internal iliac veins. Now let's talk about the lymphatic drainage, which is going to be through the internal iliac lymph nodes. Now let's talk about the function of the seminal vesicle. The secretion is going to be added to the seminal fluid by the seminal vesicle, and they are going to nourish the spermatozoa, and during ejaculation, the seminal vesicles will contract and expel the contents into the ejaculatory duct, washing the spermatozoa out of the urethra. Now let's talk about something which is called the ejaculatory duct. So here we could see the ejaculatory duct. Okay, so ejaculatory duct is less than 1 inch long, and the vas deferens seminal vesicles union is going to form the ejaculatory duct. Ejaculatory duct is going to pierce the posterior part of the prostate, and it is going to open into the prostatic part of the urethra, and this prostatic part of the urethra is going to be close to the prostatic utricle. And ejaculatory duct is going to drain seminal fluid into the prostatic urethra. Here I have a mnemonic for you. So ejaculatory duct is drain the seminal fluid into the prostatic urethra. Now let's talk about the prostate gland. Prostate gland is a fibromuscular glandular organ. It surrounds the prostatic urethra, and it is 1.25 inches long. It lies between the neck of the bladder above and the urogenital diaphragm below. Please remember this relation. So here we can see the neck of the bladder above, and this is a prostate, and urogenital diaphragm is below. Prostate gland is surrounded by a fibrous capsule, and it is somehow conical in shape. So if we consider it conical, then on the upper side we are going to see the base that lies against the neck of the bladder above, and on the lower side we are going to see the apex that lies against the urogenital diaphragm below. Two ejaculatory ducts are going to pierce the posterior surface of the prostate and open into the prostatic urethra close to the prostatic utricle lateral margin, and the ejaculatory duct goes into the seminal vesicle and then into the prostate urethra. Numerous glands of the prostate are embedded in a mixture of smooth muscle and connective tissue, and their ducts are going to open into the prostatic urethra. Prostate is incompletely divided into 5 lobes. So we have an anterior lobe, we have a median lobe or a middle lobe, and we have a posterior lobe and a right and left lateral lobe. So we have 5 lobes in total. When we talk about the anterior lobe, then please remember that it is in front of the urethra and it does not have any glandular tissue. So this is a very important point. Now let's talk about the middle lobe. It is present in between the urethra and the ejaculatory ducts, and it is the wedge of a gland. It is rich in glands, and the upper surface is related to the trigone of the bladder. Talk about the posterior lobe, which is present behind the urethra. It is present below the ejaculatory duct, and it also has glandular tissue. Now let's talk about right and left lateral lobes. So they are on each side of the urethra. They are separated from each other by a shallow vertical groove on the posterior surface of the prostate. They are glandular as well, and they have many glands. Okay, now let's talk about the relations of the prostate. So we have a superior, inferior, anterior, posterior, and lateral relation. Now let's talk about the superior relation. Relation is related to the neck of the bladder, and the smooth muscle is going to pass without interruption from one organ to another. Urethra is going to enter the center of the base of the prostate. Here we can see that the urethra is entering the base of the bladder from the center, and urethra is going to leave inferiorly above the apex on the anterior surface. Talk about the inferior relation of the prostate gland. So inferior relation is related to the upper surface of the urogenital diaphragm, and urethra is going to leave the prostate from the apex on the anterior surface, as we can see here. Now let's talk about what goes anteriorly. So anteriorly, I want you to remember pubic symphysis, okay? So symphysis pubis is separated from the extraperitoneal fat in the retropubic space, or the cave of Retzius. Prostate is connected to the posterior aspect of the pubic bones by facial puboprostatic ligaments. Please remember PP and RP for the anterior relation. Now let's talk about the posterior relation. So please remember RV for that. Posterior relation is related to the rectum or the rectal ampulla, and it is separated from the rectal ampulla by the rectovesical septum or the fascia of the non-Villiers. Prostate gland and the neck of bladder is present above, and on the lateral side we can see the levator ani muscle, and below we can see the urogenital diaphragm. And what can we see anteriorly? We cannot see the anterior relation here, but it is the symphysis pubis, and posteriorly we have the rectum. So rectovesical pouch or rectovesical septum is going to form in the fetal life by fusion of walls of the lower end of the rectovesical pouch of the peritoneum. So a rectovesical pouch is going to form the rectovesical septum somehow, which originally extended down to the perineal body. Now let's talk about the lateral relation. So anterior fibers of the levator ani, as they run posteriorly from the pubis, they are the relation. Now let's talk about something which is called a prostatic urethra. Prostatic urethra is 1.25 inches long. They are going to pass through the prostate from the base to the apex, where it becomes continuous with the membranous urethra. They are the widest and the most dilatable portion of the entire urethra. Now let's talk about something extremely interesting, which I have also shown with the help of a diagram. So a longitudinal ridge or a urethral crest is present on the posterior wall. So here I have drawn the urethral crest, which is triangular here. So a urethral crest is on the posterior wall of the prostatic urethra. And the groove, which is called the prostatic sinus, is going to run on each side of the urethral crest. So these, we can see the prostatic sinuses, okay, on either side of the urethral crest. And prostatic glands are going to open into the prostatic grooves or the posterior sinuses. So glands are opening here. And prostatic utricle is a small depression which is present on the summit of the urethral crest. So here we can see the prostatic utricle. And then let's talk about something else. What goes on either side of the prostatic utricle? So prostatic utricle is an analog of uterus and vagina in females. Okay, so openings of the two ejaculatory ducts are on each edge of the mouth of the utricle. Now let's talk about the function of the prostate. So it secretes a milky fluid, which is rich in citric acid and acid phosphatase, which is added to the seminal fluid at the time of ejaculation. Smooth muscle is around the prostate gland is going to squeeze the secretion into the prostatic urethra. Secretion is alkaline and neutralizes the acidity of the vagina. Now let's talk about the blood supply of the prostate, which is the same as in the seminal vesicle. It is the inferior vesicle and the middle rectal arteries. Both are the branches of the internal iliac arteries. So now let's talk about the veins. So veins from the prostatic venous plexus are going to drain into the prostate. They are going to lie outside of the capsule of the prostate. Prostatic venous plexus is going to receive veins from the dorsal vein of the penis and numerous vesical veins, and it is going to drain into the internal iliac veins. Lymphatic drainage is going to be into the internal iliac lymph nodes, and nerve supply is inferior hypogastric plexus and sympathetic nerves are going to stimulate smooth muscles of prostate during ejaculation. Let's talk about the visceral pelvic fascia. It is a layer of connective tissue that covers and supports the pelvic viscera. So now let's talk about the peritoneum of the prostate. You can understand this better by a sagittal plane tracing. Now I have a very interesting story for you. Here we have something which is called the parietal peritoneum. We are going to learn how we are going to spread some curtain. So this curtain is in the form of peritoneum. So first of all, let's talk about the parietal peritoneum. So the parietal peritoneum is going to reach the anterior abdominal wall, and then it is going to go into the bladder. So first of all, it is going to cover the upper surface of the bladder, and then it is going to run down to cover the posterior surface of the bladder. And then it is going to cover the upper ends of the seminal vesicle, and then it is going to sweep backwards onto the rectum to form the rectovesical pouch. So A, B, S, R were the mnemonics for now. Now let's talk about what goes into the rectum. So in the rectum, we are going to talk about middle 1/3 and the upper 1/3. So the peritoneum is going to pass on front of the middle 1/3 of the rectum and front and lateral surface of the upper 1/3 of the rectum. And it is going to become continuous with the parietal peritoneum now. And then this parietal peritoneum is on the posterior abdominal wall. And then the rectovesical pouch is the lowest part of the abdominopelvic peritoneal cavity when the patient is erect. Now let's talk about the peritoneum covering on the superior surface of the bladder. So please remember LPL for that. The peritoneum is going to pass laterally to the lateral pelvic walls, but it does not cover the lateral surfaces of the bladder. As the bladder fills, the superior wall is going to rise up into the abdomen and peels off the peritoneum from the anterior abdominal wall, so that the bladder is in direct contact with the anterior abdominal wall.